Hello, everyone, and welcome to our X39 Patching Podcast. It's Thursday night, March 10th. We are so excited to have you all on the call for the next 30 minutes. We have a special evening for you. We have Dr. Ray Pevey. He has been a chiropractor for over 38 years in Arcadia, California. So he is in Southern California, my dear friend for over a decade. And he has started using the LifeWave X39 stem cell activation patches for himself and for his patients. And I am honored tonight that he has come to talk about his experience for himself and in his clinic. Also super excited that Dr. Stacy is on the call with us, and she is back with us after she has been working so hard with her beautiful daughter Taylor, bringing her back home now. And we just are so happy that you are back with us and everyone is doing better tonight. So with that, Dr. Ray, and also I want to say LifeWave is not intended to cure, treat, or diagnose any disease. And so with that, doctor, I'd really like to start with, how did you learn about these patches? What was going on with you, as a doctor, a chiropractor for 38 years, working with many different modalities? Like, why did you even look at this? Why did you try them for yourself? And then why are you moving into utilizing them with your patients?
Well, that's a really good question. Quite a few questions there. But really what it comes down to is I was already doing a type of therapy in my office that uses photomodulation or phototherapy, which is what LifeWave patches are. And I was treating very successfully in my office for the last 8 years peripheral neuropathy. And this uses infrared light therapy, which elicits a way in which to increase blood flow. So when I heard about LifeWave patches and found out the mechanism had to do with the photo emissions of the body being reflected back in and igniting this amazing reaction to migrate stem cells for regenerative properties, decrease inflammation, brain function, circulation, it really got my attention because these were two parallel types of therapies that could prove very influential in my practice. So lo and behold, I went on board, but just to share a little bit of personal experience with LifeWave patches on my part, I had an accident with my shoulder working out and I tore a rotator cuff tendon. So as a result of that, I knew I was going to need to have surgery. But knowing that LifeWave patches have the ability to help with regenerative aspects, such as collagen improvement, reduction of any kind of scar tissue formation from the surgery itself, but just promoting the regenerative aspects of the body to recover from the surgery. I started using the patches about a month before my surgery very faithfully, and found out that after the surgery and how I was progressing after the surgery, I was actually completing my rehabilitation anywhere between about 8 to 10 weeks ahead of schedule. And for a person of my age, I'm 63 years of age and feel 20 years younger than that, actually. But that's pretty remarkable for someone to be able to come back that quickly at this stage. So I would attribute a lot of that recovery to the science behind the LifeWave patches. So there you go. That's some of the background on that.
So Dr. Ray, I know that you have been a chiropractor for many years, and one of your specialties is treating a peripheral neuropathy. I mean, you might be able to pronounce that better. And that tell us a little bit about those types of patients, what that is, how you treat them, and really what's happened now that you've added some of the LifeWave protocol.
Oh, great. I'm glad you asked that question. So peripheral neuropathy is a condition that's very common to diabetics. although folks that have had chemotherapy can develop it for cancer treatment, as well as folks that have also had cholesterol medication for a very long period of time. But in essence, it's a decrease in blood flow to the peripheral parts of the body, like the hands and the feet. And this causes nerve damage. The nerves are highly sensitive to a loss of oxygenation and nutrition and the removal of waste products. So by using this type of approach with the treatment I was using in the office, I was getting really good results. Well, just to give you an example, after about the initial 4 weeks, we do a screening to see what the measurement of improvement is. So we were seeing on the average after 4 weeks of treatment, about a 20% improvement in patients in terms of restoration of sensations like feeling their feet better, standing better, balance improvement, hot and cold recognition. But then I started applying the patches as a protocol in addition from the start on some of these patients. And we were finding that on the average, the 20% was increasing to about 35% in the first 4 weeks. So for me, that was a big game changer as far as implementing that protocol of typically X39, using the Eon and also the Ice Wave for pain control. Using those 3 patch systems for those 3 months in the beginning as a protocol was really a big boost to that neuropathy recovery.
Wow, doctor. And someone's asking, where did you put those patches on your patients?
So the X39 and the Eon patch go on the area just below the belly button, just like a snowman, basically, one underneath the other. And then the Ice Wave, generally, because most neuropathy patients also have what's called a nerve impingement issue in their lower back at the same time, and that's where we apply the chiropractic as well. I was using the patches at that location. So we were getting the nerve from its origination point from the spinal column. And as it was working its way down to the periphery, down into the legs and the feet, we were getting an application of pain control as well from that application.
Wow, so you were patching Ice Wave in the points of pain, and then that broke the connection of pain, and you were putting Eon for inflammation and the X39 to activate the stem cell repair under the belly button. Is that correct?
That's correct. And that's where
Wow.
I've had the most success using that location and that type of combination of patches.
Well, and you said something, and please let me know, because you have so many treatment modalities, but you said something about using a low grade infrared light for neuropathy even before the patches came. What is that, and how is that different from the patches?
So I use a type of light system that will encase the feet and the hands, and it emits 2 wavelengths, near and far wave infrared. One of these are able to be seen by the naked eye, the other one is not. But these 2 types of wavelengths of infrared have an implied therapeutic approach into the blood vessels, namely the arteries, that are lined with a cell that emits a chemical called nitric oxide. And nitric oxide is a chemical that gets diminished with the aging process, but even more so in diabetics. So this neuropathy light, this infrared light that I use, actually helps to restore that and start to rebuild that capability. But here's the other kicker: when you put the LifeWave patches into play, you get a stem cell migration to help with that nerve supply, as well as the circulation improvement. The blood flows much easier through the arteries, and then there's also stimulation of the nerves as it relates to the lining of the arteries that can dilate or open up. So that's how you get more blood flow, in my opinion. I mean, that's what I'm basing the information on, why I'm getting increased results as a result of using the patches along with my infrared system.
Wow. So you already understood that light was a healing modality. And maybe that is one of the reasons you were open to trying a wearable light
Oh,
technology.
absolutely. I mean, knowing that a light system was an integral part of the healing process with neuropathy, when I found out that photo emission of the body, which is a light energy that comes off the body, and being able to harness that in such a way with the patches driving that energy back in to ignite this catalyst of stem cell activity, it made sense for me to look into it because I was already embracing the philosophy as we speak, and to see this working in another way made complete sense.
So you said something on the last call that really like made me stop in my tracks. You said something about you felt more comfortable helping more severe cases now. What did you mean by that?
What I meant by that is, in my opinion, with the prior system of using neuropathy infrared before I started using patches, I established a kind of a line in the sand that I felt that it was just not feasible to really, unfortunately, help these people because the damage was just so severe. And so I made it a point that if a patient tested above, say, 75% sensory loss, I would not accept them as a patient because I just felt it would not be feasible for them to get results. And I just didn't want them to waste their time and their effort and not see success, because I want people to succeed. But I started looking at things a little differently with how the patches were modulating these improvements. And I started accepting a few cases, and I just told them, hey, if it doesn't work, we'll work on, the cost factor to help you out, but let's go with this and let's see what happens. And so I was accepting cases above 80%. I had one at 85%. Frankly, they were very close to maybe developing gangrene and losing toes, amputation. So we started using the patches, and lo and behold, they cut that factor back, and they started coming back and started coming back. So we've had just a tremendous ability to help those real severe cases now, and not turning those patients away like we were before.
Wow, that's amazing.
Yeah, it really is.
So, Dr. Pevey, can you also tell me a little bit, what's your thought about the patches on immune system, and what would be your choice for that and why?
Well, the immune system, as we all know, is a very highly talked about thing nowadays, certainly with COVID and just everything that's going on. Thankfully, we're seemingly coming out of the downward turn of that. But I mean, as far as the immune system goes, a big one for me is glutathione. Glutathione is just an amazing booster of the immune system. It's been one of those things that's been difficult for us to really harness by taking it from the outside in, because unfortunately glutathione gets denatured and lowered in its effectiveness because of the digestive system. So now we have a patch that can actually activate glutathione production internally, which is the way the good Lord planned it. And so that's a game changer. Then you start using things that can boost circulation. X49, which we haven't really talked about, is one. It's a parent to the X39. So I would say X39, Eon, X49, those three there, along with, I would do the glutathione, and I would actually throw carnosine in, because carnosine is also something that is circulatory based because of its heart health qualities, and it also has brain function benefits, and also, of course, I think it has a really big potent effect on the pulmonary system, or the lungs, or respiration. So those would be really my game changers as far as those 5 patches there.
Wow. And so you say those 5 patches based on being a chiropractor that works on neuropathy. And if I understand, a big part of neuropathy is increasing circulation or blood flow. And so that's those 5 patches in your mind. Let me just repeat, and we'll go over the patches in a moment, but just really interested on how a doctor is really using this. So it sounds to me you're using X39 stem cell activation patches to turn your stem cells on, to turn into the cells your body needs to repair, Eon to stop inflammation, X49 to help with the heart and brain health and blood pressure, carnosine for the organ support as well, and then glutathione for your immune system. Did you say those 5?
Yes. Mm-hmm.
I like those 5 very much too, doctor.
Yeah. It's really an amazing complement to the various things that can be supportive in the body. So, I mean, that would be my recommendation for just about anybody to use that kind of approach. I've streamlined it a little bit, though, in the beginning with patients, the focus being the X39, the Eon, and the Ice Wave. But certainly bringing some of those other partner patches into play would be, I think, a really wise decision, if that's something a patient can move forward with.
Wow. Well, doctor, I really appreciate your time and knowledge. You can tell that he is an expert at his discipline. Is there anything else you would like to say before we move on that I have missed today?
I just want to say that for number one, it's a pleasure to be here tonight to be able to talk about what I do and certainly what LifeWave patches do. So it's just it's been a wonderful experience, and I'm looking forward to seeing it foster through. And the most important thing is, from my standpoint as a chiropractic doctor, my point of view is to try to give back lifestyle, lost lifestyle. And as I've mentioned before many a times, we take a lot of things for granted, and when we can't do them, then it's really a big issue for a lot of us if we can't walk our dog, or we can't go out and play with our grandkids, or even just simply go to the beach and drive a car. I mean, neuropathy is something that affects anybody from the standpoint of just being able to push the pedals in the car. So. But neuropathy is just a small piece to a larger pie of things that LifeWave patches are able to really help. I just happen to be one that really uses that type of treatment quite a bit in my office, as well as good family chiropractic care too. But there's so much more. It's a very diversified product as far as what it delivers on.
Well, thank you, Dr. Ray Pevey. We so appreciate your knowledge. He obviously, his practices in Arcadia in Southern California. He helps many patients every day live their best life, as you said. And we really appreciate your knowledge of how you help your patients, and also how you've incorporated the patches and why it helps us understand better as well. So thank you for that. And with that, I'm going to just talk a little bit about the technology. I mean, you can already hear from the doctor really what he's doing and how they work, but I'll just take it a little step further. So this is what he's talking about, X39. This is the beginning of the line. They are stem cell activation patches. And as Dr. Pevey says, they look like Band-Aids, but they are so much more. When you open them up, inside is organic crystal. That lattice, as Dr. Stacy likes to call it, is an organic crystal lattice made out of amino acids, sugar, salt, and water. And this patch, as Dr. Ray was talking about, is a form of phototherapy, just like that low-grade infrared light he was talking about. It turns out our body is made out of low-grade light. And this is just a wearable patch that you put on your skin to reflect back a light wave to do something in your body. I would say Dr. Pevey would call this a form of photobiomodulation. What does that mean? That means we are using light to activate something in our body. And that actually turns out to be real. Just like when you go out into the sun, your body elevates vitamin D. Light does treat. It just does. And that's the new learning that people like Dr. Ray Pevey are telling us and putting together, right? So what does this X39 patch activate? It activates a peptide in your body called GHK copper peptide. You can go look and see what GHK does. You can go to reverse aging with GHK.com. Write that down. You'll find that it's the holy grail of anti-aging. But one of the things it does is it acts as a telephone to your stem cells. It says, hey, stem cells, it's time to make your army march again. It's time to make more of you, and it's time to reset you to a younger, healthier state. And your stem cells say, thanks for the call. It's about time. Because you know what's happened? At age 30, we've lost half our stem cell activity. By age 60, we've lost almost all of our stem cell activity. So my guess is when Dr. Ray Pevey told his patients to put this patch on, it got the stem cells marching again. Why is that important? Stem cells are the only cell in your body that are changeable. Wow. No other cell in your body can change. Stem cells can change into whatever cell your body needs for repair. That's why when we're young, have you ever noticed, does Ray see neuropathy patients that are 10? Probably not too many. That are 20? Probably not too many, because their stem cells are moving, they're marching, they're working, right? But as we age and the army stops, that's when injury, issues, problems start to happen. So David Schmidt, the owner, inventor, and CEO, says, when you put young stem cells on old tissue, we turn the tissue young again. We're not anti-aging, we're age reversing. I like to say those patients that are in the 60, 70, 75 marker of neuropathy, I like to say those stem cells are turning new tissue again. Like, that's exciting, right? So that is the stem cell activation patch. If you want more information on that, you can go to startx39.com. You will see at least 100 research studies, and you'll see 100 patents. David Schmidt research has patents. He's the owner, inventor, and CEO. The X39 actually has a patent that's 20 years that says, yes, X39 does elevate GHK in the blood, and that activates your stem cells. A 20-year patent. In fact, David said this, he did another study, he loves studies. He looked at people's blood for age markers of 15 people. Then he put them on X39 for 6 months and looked at it again. What he found is that 14 out of 15 people reversed their age by 8 years after being on X39 for 6 months. That's because X39 resets 1/3 of your genes to a younger, healthier state. It's pretty amazing. So it makes sense that this is doing what it's doing. In addition, I just quickly want to talk to you about the other patches Ray talked about. Eon, that stops inflammation, that elevates a peptide to stop inflammation. He talked about Ice Wave as the pain band-aid. You put the brown patch on the pain spot, the white patch 3 inches away. And did he remember how we talked about putting it between the neuropathy where that pain was? That breaks the connection of pain in the connective tissue. Why X39 and Eon heal. He talked about X49 helping with organ support and with blood flow. And he talked about carnosine helping with organ support and blood flow. And lastly, he talked about glutathione as your immune system booster and your main detoxification. We normally only talk about X39 on these calls, but I really wanted to showcase the patches that doctor is using So you understood more how a practitioner is actually helping his patients. So with that, Dr. Stacy, why don't you let everybody know how they can get these patches?
Absolutely. Thank you. Well, thank you, Dr. Ray. That was fabulous to hear how you're utilizing these patches, not only with yourself, with your shoulder, but also with your clients. So thank you for sharing all of that. Wonderful information, of course, as always. And Marcy, love you, girl. Miss you. I'm so blessed by you and grateful that you were here bringing this to us every single week. So I'll share with you guys how you can get the patches. We'll talk just about the different ways. And of course, you can mix and match and get whatever patches you want. But basically, we have the X39 stem cell activation patch. This is a month's supply, and you can get this for $149.95. Okay, that's a month's supply. So it's about $5 a day. Not too bad considering the price of stem cell injections run in the thousands to tens of thousands of dollars. So that's the X39 that Dr. Ray has talked about. You can do that for retail, of course. We do have a preferred customer program if you're interested, and you can purchase a one-time fee as a preferred customer. It's $19.95, and you can purchase that X39 every single month. We can set you up on an auto ship for 6 months, and it's $99 a month. So you can get the wholesale price as a preferred customer, but we all really love the silver pack. And the silver pack is a wholesale pack that allows you to not have a sign-up fee. You don't have any set amount of time that you have to order anything every single month. And like I said, you can get the X39s, or you can mix and match and get some of the other patches that you heard Dr. Ray talk about with inside of the silver pack. So it gives you flexibility and freedom and wholesale pricing. So you can get 3 X39s. It's only $2.99 for the silver pack. You can get one for yourself, one for a friend or a spouse, family member, and of course, one to share, because you know everybody's going to want these as well too. And you can get your auto ship set up for the next month, and you can put the X39 on that auto ship, or you can put other patches on that auto ship the next month as well too. So pick whichever pack works best for you. But the main thing is that you get back with a person that invited you. They can go over these wholesale packs with you and to customize to make sure what is best for you and your family and your needs. And of course, get back with the person that invited you, like I said, but know that we are all here to help you and support you. I know we had over 220 people on this call tonight, so there's lots of questions. I've seen lots of questions come in tonight, but know that LifeWave as a company is 17 years old. David Schmidt is the owner, inventor, founder, the lab rat, the scientist, researcher that has invented these incredible patches and done all of the clinical studies that Marcy mentioned, over 80 clinical studies. And he has over 130 patents himself, with the stem cell activation patch having a 20-year patent on it. So know that the things that you've heard tonight and the things that we're saying are backed by science. They're backed by research, they're backed by facts, and they're also backed by thousands of testimonials, which is why we are on here Monday through Thursday evening, every single night, 9 p.m. Eastern, because you hear from 1 to 2 different people every single night and their personal testimonials and what's working for them. And we have over 2,000 recorded testimonials now in just the last couple years. So know that you're using a product that is backed by science and research, but also proven effective for thousands, tens of thousands of people that have been utilizing it themselves personally. So with that being said, I'm going to turn it back over to you, Marcy. I know we have our Saturday training, so you'll be able to fill everybody in on that. And it was great to be back with you guys again tonight. So thank you.
So much fun. Just like the old days. It's wonderful. Thank you, Dr. Stacy, for telling us all. And Dr. Ray Pevey, thank you so much for coming and sharing your story and your patient's story. I think we all learned a lot tonight. I'm seeing that all over the place. So in gratitude for that, we do actually, Dr. Stacy, have our Friday afternoon call tomorrow. It's new on the calendar. And it is Laura Bowser and Wendy Morgan. They will be hosting our first afternoon call, 1 o'clock Pacific, 4 o'clock Eastern. It's our Patching Podcast call. Yes, we did hear you, East Coast. We know you wanted an earlier show. We have done it. We thank Laura and Wendy for putting that on. You can find that invite at startx39biz.com under invite to podcast. The new invite is up, but if you forget, it's the same zoom.us, and you plug in 379-717-7845. That's tomorrow. And of course, Saturday at 10 a.m. Pacific will be our training call. With that, lots of love to all of you. Thank you, Dr. Stacy. Thank you, Dr. Pevey. My gosh, how can I become a doctor? We love you all and have a great, great night. Bye-bye.
Good night.
Thank you, Marcy.
Thank you, Marcy.
Great call.
Yeah.
Thank
that was
you.
awesome.
Good night.
Very awesome.
Marcy and
Great
Stacy.
call, everybody.
Wonderful call.
Thank you
so much.
Very good.
Wonderful.
Good night.
Marcy.
What's up, everyone?